Great, and we're going to have one more question from Twitter. Can we compare SAE of opioids to that of cannabinoids through existing separate studies? Can we compare SAE of opioids to that of cannabinoids through existing separate studies? Significant adverse effects, I think. Yeah.
Well, sure. I mean, opioids can produce, or maybe, Bart, if you want to tackle this one, but opioids can produce very serious side effects. I mean, obviously, respiratory depression and lethality can occur, undesirable for therapeutic intervention. Constipation is nearly universal. Tolerance, opioid-induced hyperalgesia, and of course, physical dependence. And so I think cannabinoids, even by contrast, if you look at withdrawal from opioids compared to withdrawal from cannabinoids, the cannabinoid withdrawal syndrome is milder, clearly, and it lacks a lot of those pronounced autonomic signs, at least what we see. So I would think that the serious adverse events are even greater for opioids.
Yeah, I'm not sure I can compare them. I mentioned that study by Mark Ware in Canada that over 200 patients who were on cannabis didn't have increased incidence of serious adverse events compared to the control patients, the people who were not on cannabis. I would remark that in the case of opioids, numerous opioids have undergone FDA approval. So they have numerous studies involving administration over 8 to 12 weeks. Now we know that people have inadvertent overdoses, and there's certain reasons for that. If somebody has a history of addiction, if somebody has a serious psychiatric illness, they're more likely to have an inadvertent overdose. But in the studies that were done before this became apparent, before inadvertent overdose became more problematic in terms of fatalities than motor vehicle accidents in this country, we had a lot of studies that involved FDA approvals on opioids, and I didn't see this problem. In fact, during my 20-year career in pain medicine, I was not aware of this problem until Pelosi at the CDC discovered the overdosing was now from opioids. So that's not that recent, but I was kind of shocked. They're not that safe. In fact, the CDC is now saying, at least to primary care doctors, try to use physical therapy and cognitive behavioral therapy and try to avoid opioids. In my experience, that's been difficult because insurance companies won't pay for physical therapy and cognitive behavioral therapy. So the CDC director is trying to change that, and I hope he does. I still see that, I've watched the pendulum swing from when I was a medical student, when we wouldn't give an opioid to a young woman dying of cervical cancer because she might develop tolerance to it and might need it later. And that's a true story 40 years ago. And then the pendulum swung during the 80s and 90s where we were giving it out like holy water in the pain clinic. And now we're back to being very careful with whom we're giving it, trying to choose patients who don't have, as I said, histories of addiction or histories of serious medical, psychiatric illnesses, and watching people more closely, doing urine toxicology screens, doing these surveys that we give that point out a propensity to abuse opioids. But I think there's always going to be a place for opioids, and now I'm hoping that cannabinoids can be used in conjunction. I can see somebody, we've been talking about PTSD here, I can see rational therapy where somebody with PTSD might use cannabis just in the evening to help treat their insomnia, help them forget. What medicine is there better than a cannabis to forget something?
I'd like to thank everybody on our panel and turn it over to Dr. Stein for announcements about lunch.